Welcome to Logic Medico. Today's interesting topic is perineal membrane. So perineal membrane is a tough connective tissue found in the perineum. It is found in the junction between the superficial perineal pouch, which is here. This is the penis scrotum, and this is the superficial perineal pouch. Okay, and this is a deep perineal pouch. Between the two pouches, there is one membrane. On cut section, this membrane appears like a separation between the two, but actually it is triangular in outline. So this membrane is between the deep perineal pouch and the superficial perineal pouch. That is the location of perineal membrane between the superficial and deep perineal pouch. Come on to the boundaries of the perineal membrane. I already told the shape of the perineal membrane. It's roughly triangular in outline. The boundaries anteriorly is the apex. This is apex. It's right at the lower edge of the pubic symphysis. It is bounded by the one ligament here. It's called the arcuate ligament of the pubis. Here the perineal membrane, this membrane gets thickened to form the transverse perineal ligament. Isn't it oriented transversely? So this is transverse perineal ligament. So that is about the transverse perineal ligament. That is about the apex of the perineum. Coming to the base is directed posteriorly. Here it is bounded above by the deep transverse perineum superiorly and below by the inferiorly by the superficial transverse perineum. But in the midline, it is attached to the base of the perineal body. Perineal body is a fibromuscular node where the perineal muscles will get attached. It's pyramidal in shape. So where it's getting attached to the base of the pyramid, the perineal body. So this is about the base of the perineal membrane. Whereas the laterally, the perineal membrane gets attached to the periosteum of the istiopubic ramus. This is the ischium and this is the pubis. Obviously, this is called the istiopubic ramus. So that is the lateral attachment. So anterior attachment we saw, posteriorly we saw, and the lateral. These are the attachments of the perineal membrane. Moving on to the structures piercing the perineal membrane. The structures piercing the perineal membrane are as follows. Already I have written the outline for you. So this is the perineal membrane. So a simpler diagram like this will help you in the exam to get good marks. So the following structures pierce the perineal membrane. First we have to label this structure. This is the urethra. This is the duct of the bulbourethral gland. Duct of the bulbourethral gland. In male only. Whatever I am talking is in male only. In female, an additional structure will pierce, and that is a vagina. So here I am depicting only the male. So next, moving on to these arteries. This is a dorsal artery of penis. This is a deep artery of penis. Dorsal artery. And this is a deep artery of penis. Two arteries we labeled here. Here, one of the arteries supplies the urethra. So can you call it as artery to the urethra or the urethral artery? Yes, of course, you can call it as urethral artery. The other artery is supplying the bulb of the penis. So this we can call it as artery to the bulb of the penis. Artery to the bulb, we can call this. These are the muscular branches. You can see here. These are the muscular branches to the muscles present in the superficial perineal pouch. There should be some muscular branches of the perineum. These are the posterior scrotal branches. Obviously, along with the posterior scrotal branches of these nerves, we have the posterior scrotal vessels. Already we can see that these are the posterior scrotal arteries. So to understand these posterior scrotal arteries, we will show you a simple diagram. So this is the penis and this is the scrotum. These blood vessels are going to emerge like this from behind. So when they are coming from behind, obviously we call it as posterior scrotal arteries, and the nerves will be called as posterior scrotal nerves. When they are coming from behind, obviously this base of the perineal membrane is directed posteriorly, so they will be over here. Whereas urethra, you can see that the urethra, just explain. The urethra is on the anterior plane. Urethra is just 2 to 3 centimeters below pubic symphysis, below this level. So it should pierce the membrane, perineal membrane. That portion of the urethra passing through the membrane will be called as membranous part of the urethra. Passing through the penis is called the penile urethra, and that portion within the prostate is called prostatic urethra. So this perineal membrane is an important membrane. In order to summarize, I'm telling you the summary. Perineal membrane, and it's triangular in outline, present in the perineum in the junction between superficial and deep perineal pouch. Apex is directed anteriorly and is just inferior to the pubic symphysis. The anterior edge of the perineal membrane is thickened here to form the transverse perineal ligament. This is the entire perineal membrane, just shading it. Posteriorly, it is continuous with the superficial and deep perineal pouch, but in the midline there will be one perineal body, the base of the perineal. This is the perineal body labeled here. On either side, it is attached to this istiopubic ramus. The periosteum of the istiopubic ramus is a lateral attachment of this perineal membrane. Moving on to the structures piercing perineal membrane, one by one. The urethra, the duct of the bulbourethral gland. Moving on to the arteries, the dorsal artery of penis, the deep artery of penis. So the difference is the dorsal artery of the penis is on the dorsum of the penis. It will be here, okay? Whereas the deep artery of penis is within the penis. Because it's called the deep, no? So it should be within the penis. This is a deep, this is dorsal artery. And for when we have the urethra, so obviously we should have the urethral artery. Artery to the bulb of the penis. Posterior scrotal arteries. I have shown it here also. Posterior scrotal arteries. Then muscular branches to the muscles present in superficial perineal pouch, and posterior scrotal branches for the skin of the posterior part of the scrotum. Thank you for watching and learning from Logic Medico. If you are new to our channel, kindly consider subscribing to our channel, and don't forget to press the thumbs up icon. Thank you for watching and learning from Logic Medico once again. Kindly share this video with your friends, and don't forget to like this video. Thank you once again. Bye. Good day.